I can answer also what is the difference between plasma pen and Plexr. So plasma pen mostly is just a marketing name. So I'm going to divide that for for better understanding to two different parts. Number one, fake plasma pens, so-called plasma pens. Number two, true plasmas. So 99.9% of everything that in the market you hear as a plasma pen, they do not generate any plasma. They are low frequency electrocautery device, and you can find them on Amazon for $15. And we had an experiment once, and I have the video, which we basically got a device claiming I'm made in Germany, and it was like at that time, it is like 15 years back, it was like about $10,000. So the device was very similar to one of the devices that we knew from basically Amazon. So our technical department, they purchased one from Amazon, and we had one of this device. We opened them in front of the camera. I'm gonna share this video in our next training. And inside, they were exactly the same. So basically, they just used that plasma pen, turn it to a more expensive device. But the thing is, we tested all of those, and they are low frequency, basically electrocautery device. Now, what is the difference? The difference is the low frequency electrocautery device does not ionize the nitrogen. So you don't have any plasma because it doesn't have the intensity, the power to do it. So you are burning the tissue using electricity. And that's why you hear about all the side effects and problems and fat necrosis and lung healing and burn and the scars that comes from plasma pen. Now, so this is one category of basically fake plasma. And they are using the name plasma because basically plasma was very successful. Dr. Crowley, you always say that plasma is the future.
Mm-hmm.
And that's why people want to jump into this market and use the name plasma.
Someone wants to know if this was already tried on people who had hair loss due to chemo.
We don't have any experiment for those people because it's a very new technique for hair grow. But the thing is, for example, we use Plexr for like psoriasis. We use Plexr for dermatitis, for eczema. So one of the things that plasma does to the skin is it revives and rejuvenates the skin, you know? So then the mechanism of action of Plexr for hair grow is basically three things: activating angiogenesis and blood circulation, which is the main thing that you want to happen. And then the second one is the biostimulation of the follicle. And the third one is it is antibacterial and fungal. So these three mechanisms of action, they also help for after chemotherapy, but you need to make sure that because after chemotherapy, the healing power of the body is gone, kind of. So you don't want to use cat resurfacing or ablative. If you want to do something, it's going to be just Plexus shower. Dr. Crowley can complete that.
Yeah, so I don't think the thing is, it's not going to, obviously the mechanism of hair loss and chemo, it's not going to reverse that. So you're not going to use that in an active patient undergoing chemo. It's not going to mitigate hair loss from chemo or help that. But when they're completed their round of chemo, that is when we can try to speed up the process. So as their hair is starting to grow back, certainly I would feel comfortable using this technology. No, there's not studies on it. But we've treated post-chemo patients in our practice definitely for a while now with a variety of techniques to support hair growth and to support that process of them growing their hair back. You want to make sure that they definitely are not going to heal wounds normally, right? Their body's ability to do that for a long time after chemo. So somewhere, a minimum of 6 months to a year, that process is going to be impaired and maybe even longer. So hair is a tricky area to treat. And one of the things that I see, regardless of whether you're using injections, topicals, Plexr, micro, any of those things that you're using, if you haven't addressed underlying causes of the hair loss, none of those technologies are necessarily going to be effective. And so when I say that, along with chemo, but you have a lot of other deficiencies. So you can have vitamin deficiencies, you can have abnormalities and different sorts of, you know, your thyroid function, your B12 level, your hormone levels, all of those things will impact your hair. So this is an effective mechanism that I would use to stimulate moving hair from the resting phase and the more active growing phase, and especially after they shed all their hair from chemo. But don't forget all those other things that are going to go into it. We could do a whole session on just hair alone,
Yeah,
because there's a lot of things that factor into that.